Hey guys, welcome to Rihanna's Lens, where I interact with you about the components in the STEM field and introduce you to fascinating people who passionately inhabit the scientific and technical frontiers of our society. My name is Rihanna Malhotra, and I'm absolutely elated to share this podcast with all of you. On this episode, I'm joined by a guest who's a cardiologist and research scientist in an intensive care unit in Ukraine. She's part of many European Cardiology associations and is also the head of the Council of Young Scientists at National Therapy Institute. I'm so thrilled to welcome and introduce Tatyana Storozhenko and can't wait to begin our discussion. Thank you so much for coming on. I'm not that adept in the Ukrainian language, but Привет, Tatyana.
Hello, everyone. Nice to meet you. And a few words about me and my profession, yes?
Yeah. I really admire your profession. It's something I really look up to.
So, at first, I was introduced to medicine at age 16. I passed exams and I went to medical school. And I think the luck was on my side, and I got a scholarship. So I didn't pay for my education. It was big luck. Government paid. And it was a very hard way. You know that medicine is school for all your life, and you should study hard and work hard to be a good specialist. So after my medical school, I trained in internship and clinical residency for a few years. And I had my first patient at age 22, 23, very early. Next step was cardiology. So I decided to choose a cardiology field, and I like it very much. It's a very wide field. You should have a lot of skill sets, and you always improve your skills, your knowledge.
Right. And also, right. But since you're now a cardiologist, I just want to ask you, what does a day in your life usually look like in the hospital?
The hospital? I have not only one job, yes. Yeah. Early in the morning till from 9 to 4 o'clock, I work in National Therapy Institute at hospital with patient and outpatient persons. And it looks like you come to your work, to intensive care unit. It's very stressful work because you have different patients, severe patients, and sometimes it's like outpatient, not very severe. You have rounds between patients. You like a doctor, you consult patients, you diagnose, you should know a lot of different skills in imaging, in treatment, electrophysiology, and intervention, for example, for cardiologists, and a lot of different skills. So you always move. You don't have free time. Then in the evening, I go to private clinic and I have private practice. And when I have free time, or maybe 1 or 2 hours for a day, I use it for telemedicine.
Okay. I really marvel your dedication, and I'm sure that working in an ICU unit is definitely very rapid, and there may be many patients coming in and everything.
Yes, yeah. You're right.
And why did you choose to specialize in cardiology specifically?
To be honest, I wanted when I was a student, I wanted to be a surgery. But then something changed in my life, and I decided to be a cardiologist because you have different options in this field. First of all, you can consult patients. Yes, it's like outpatient practice, but you can be involved in intervention. Intervention, it's like minimally invasive cardiology.
I think both the professions, being a soldier and a cardiologist, are really respected. Yeah. And what is the most challenging aspect of being a cardiologist?
I think it's the same in all fields of medicine. Work hard 22 hours a day. And I think you should know what do you want from your life and your work. If you want to choose arrhythmology, you should focus on this field, subspecialty. If you want to be pediatric cardiologist, you should focus on kids, yes? So choose before study.
So now that there's COVID-19, this huge pandemic, how has life in the hospital changed for you?
Yes, it changed because at the same time, I'm a research scientist and we have a lot of scientific projects related with COVID-19. We have a lot of different patients with post-COVID diseases. For example, myocarditis, pericarditis. Yeah, it's harder to work. A lot of patients have they have severe condition, and we need to treat to help them. It's I think it's harder now to work because there are the number of patients bigger and increased, and severe patients increased. So and I work in intensive care unit, so I work more hours than before.
Right. And how do you feel after you treat a patient? Like, do you feel happy? What is the most rewarding aspect?
After treatment?
Yeah, after treating a patient, how do you specifically feel?
My feelings?
Yeah.
I'm happy if I can help people.
And while you're researching, since you're a research scientist, are there any special equipments that you use?
Yes, of course, we use special equipment, special tests. For example, we study novel biomarkers, lab tests we use, and we use sometimes maybe not special. I think it's combined, special and routine equipment.
And I also know that you are a part of so many European Cardiology associations. So how has the experience been for you?
It widened my horizons, I think, with international collaboration. And I can meet different cardiologists from worldwide. Yes, and change our experience between our scientific groups or practical groups between cardiologists. I can know new trends, novel techniques from European or world top specialists.
Yeah, right. Definitely, you can meet so many new people, and also you're the head of the Council of Young Scientists of National Therapy Institute. So, what is your main role there? What do you do in that institute?
We help young doctors and scientists to get fellowships, to get practice, and we organize conferences, international conferences.
Wow, that's really great, and I really admire how you tirelessly work and proceed towards your aspirations. And lastly, is there any advice you want to give to any cardiologists out there, or anyone that's wanting to be a cardiologist?
My advice, I think you should love your profession. It should be your passion. So you will spend, you know, that you will spend a lot of time at work, at medical school, in trainings. So before do first step, you think you should think a lot if it's the right step or not. If you're really sure that you want it.
Right, I completely agree, and I really appreciate your guidance and the time that you took to come on my podcast. Thank you so much for coming on. That's it for today. To let all of you know, this podcast is now available on Spotify, YouTube, Google Podcasts, Breaker, RadioPublic, and PocketCast. Make sure you subscribe to all listening platforms. Thank you so much for coming on, Tatyana.
Thank you. Thank you very much. Bye-bye.